condition, situation. It depends upon the condition. Wherever accumulation is there, we sedate. No. Expel means sedate. Is it not? Even yesterday also Krishnamurti sir explained what is yellow on top, what is north, what is south pole. What increases the energy, what decreases the energy. So, according to the need, depending upon the situation, but most probably in many cases, generally, digital points are used to disperse the energy. Digital point means, see, imagine, you are in Bangalore, your house is in Banishankari third stage, but the doctor sits in Yelahanka, which is a bit far away from Banishankari. But everybody has to go there for treatment. Like that, the place of treatment is far away from the focus of disturbance. Not only that, the digital points, once again I'm repeating, what you have to keep it in mind is, it has got special effects on this specific part of the body, which has got the potential to tap the body's natural healing system. It will increase blood and energy flow, or it will control from a distance, not local points. It is not situated locally. Similarly, SP9 is another very important digital point, which are very useful for treating edema and ascites. Ascites means liquid or water accumulation, fluid retention in abdomen area. SP9 is single point to treat, not only in abdomen, even on the lower extremities. Whenever there is fluid accumulation along with stomach 40, if you use SP9, which is the distal point for the lower extremities, for edema due to fluid retention, you have to compulsorily use SP9. Whoever has got swelling in the leg, especially on dorsum of the foot or on the ankle, if you use SP9, the result will be very fast, in addition to your local points. Then SP10 is a distal point for allergies and skin related issues anywhere in the body. Spleen 10 is located in the leg, on the medial side of the leg, but it can influence on skin related issue anywhere in the body. Whenever you treat any skin disease or anything related to allergy, usually when we treat allergy, we also use liver 3, because liver 3 is the master point of liver meridian, which controls all the chemical parameters of the blood. So your treatment will be very affected, along with, if you add SP3 also, along with SP10. SP10 is the distal point for allergy and skin related issue in the whole body. Even serious diseases like urticaria, psoriasis, eczema can be treated. In your protocol, you have to compulsorily use SP10. Of course, we'll come to, when you come to influential point, there is one influential point for blood, that is UB17, we'll discuss separately. Anyhow, this you have to keep it in mind. And then H5 is the distal point for speech difficulties. Whenever a child comes for speech related issue, or a person who is suffering from paralysis, due to which speech difficulties is there, then in your protocol compulsorily you have to use H5, which is the distal point for any speech related issue. H5 is located on the hand, but it will treat the tongue. Similarly, SI3 is important distal point for tinnitus, deafness. Not only that, it will, whenever we treat the upper back, including cervical spondylitis, you have to compulsorily use SI3, which is the wood point of this SI meridian. I mean, it is a distal point for, it is also one of the distal point for upper back along with LU7. And similarly, SI6 is also a distal point for neck. See, whenever you treat a person related to cervical and neck related issue, compulsorily we have to use SI6 also. SI6 is also, can anybody tell me what it, it is not only distal point. We are going to discuss about what is Z-cliff point. In that, it is also a Z-cliff point. Anyhow, character of Z-cliff point we'll discuss later. But now we are restricted to distal point. SI6 is located on the hand, but it will influence on the upper back related to the, anything related to the shoulder and neck. And then UB60 is, see, UB60 is a distal point for sciatica pain. Actually, for treating sciatica, just, I told you UB54 is the distal point for lower back. Along with that, if you use UB60, which is the distal point for sciatica, and anything related to lumbar area, and even for cervical spondylitis, UB60 is on effects on the lower part, but it can also affect on the neck, because according to Dr. Tan concept, we are going to discuss it later in the higher semester, but you can now just note it. UB60 is also a very good influential point for cervical. So friends, Professor Krishnamurthy has joined. So it is, I'll continue this session in the days to come. Before the examination, we will complete TCM revision, and we'll also take out, answer 1 or 2 question papers of previous examination, so that it will be very useful for you to face the examination. Now, on behalf of every one of you, I extend a very hearty welcome to our beloved Dr.
Sir, namaste. I will need 1 more minute. Yeah. Apologies for the delay.
No, not at all, sir.
Just give me 1 more minute.
So engage. No issues. Thank you. Welcome once again.